my name is Kaylin Anders. I'm going to be performing inserting an IV and then discontinuing an IV today. So first things first, we want to go ahead and wash our hands, do hand hygiene. Second, we want to put on our gloves. And then I'm just going to go ahead and palpate for vein to see if I can find a good one. Okay, so I found a good one right here. So I'm going to go ahead and apply the tourniquet. And I am using an 18 gauge needle because it is a 18-year-old patient going in for surgery. All right, so now that I have the needle, or the vein that I picked out, I'm going to go ahead and clean it with the iodine, about 30 seconds in circular motion. And then I'm going to go ahead and let it dry for about 30 seconds. All right, so next we're going to go ahead and anchor the vein. And I'm going to go ahead and insert my needle. And I do see blood return, so I know that I'm in the vein. Okay, so I'm going to go ahead and advance the catheter in, and I'm going to hold it so it doesn't come out. I do have my needle, so I'm going to put the safety on and put it in the sharps container. So I'm popping the tourniquet so that we don't hurt the patient. All right, so now I'm going to go ahead and I have my saline right here with my extension tube, and I'm going to plug that in, perfect. And I'm going to go ahead and hook up this normal saline to the IV. And I'm going to go ahead and aspirate to see for blood return to make sure we're still in the vein. Yep, there's blood. All right, now I'm going to go ahead and push this flush into the vein. All right, perfect. Everything's good there. I'm going to discontinue the flush. All right. Now I'm going to go ahead and put tape on the insertion site, and we're still kind of holding down on this. Perfect. I want to take off the white piece of the tape. Okay, so now it is secure, and I do have my sticker that has initial date and time, so I'm going to go ahead and put that on. Perfect. And I am going to put an extra little piece of tape on here just so that it remains intact for sure. I'm going to kind of loop the extension cord just so that it's not in the way of anything else. All right, perfect. And that looks like it is all done. So I'm going to go ahead and remove my gloves and perform hand hygiene. And then next is discontinuing the IV. So I'm going to go ahead and do hand hygiene again, put my gloves on. Okay, we're going to kind of hold down the IV so we're not pulling it out of the skin. I'm going to take off the tape. Taking off this tape. All right, so now what you want to do is you want to pull the catheter out while having gauze right here. So now you have gauze, you're holding that down so they're not bleeding, and you want to just inspect the catheter to make sure everything's intact and that there's no pieces left in the person's body. So everything looks good, so I'm going to go ahead and discard of that, and everything is good. They're done bleeding here. So I think that is it. I'm going to go ahead and take off my gloves, discard of them, and perform hand hygiene. And that is it.